Good morning, everyone. Buenos días. My name is Alicia Fernández, and I work with the UCSF Latinx Center of Excellence. Today, we will be holding a webinar that is hosted by the California Consortium of Centers of Excellence in Latinx Health. That includes UCSF, Stanford University, and UC Berkeley. We couldn't be more thrilled to be doing this in coalition and in partnership with the San Francisco Latinx Parity and Equity Coalition and the Latinx Kitchen Cabinet. And we have some wonderful speakers. Our goal for today is to have ultra short presentations, mainly so that people will be able to see what different groups are doing, learn about the issues, and use this as a beginning of a dialogue. We know that the people who are listening are members of many community-based organizations, and we want to make sure that we can all work well together during these crucial times. The webinar logistics are that all attendees are in listen-only mode, but we are leaving, we hope, plenty of time for Q&A. And if you have a question, you can enter into the question panel. The webinar will be recorded and will be posted on our website. We will also be sending out on Monday emails with slides and resources. So with that, we'll get started. Today's presenters, if you go back one slide, include Dr. Fernando Mendoza, Professor of Pediatrics and PI, the Center of Excellence from Stanford University. Heather Ladov from Clínica de la Raza, Casa del Sol. Next slide. Gena Castro Rodriguez, Chief of Victim Services from the Office of San Francisco District Attorney. Chris Iglesias, CEO of the Unity Council. And Theresa Gonzales, Executive Director, Centro Legal de la Raza. Next slide. As we begin, we just want to point out that while this webinar will be focused primarily on the Latinx community in the region, we know how absolutely wonderfully diverse our region is. If you look here, you will see that in the United States, California is, as we all know, much more diverse than the United States as a whole, and particularly with regards to the Latino population, now almost at 40%, and and Santa Clara is perhaps the most evenly distributed, most diverse county in California. So, in addition to that, all of our counties have a large number of immigrants, with more than 1 out of 3 being foreign-born. Next slide. Okay, so let's talk really quickly about San Francisco. San Francisco, as you know, has been highly successful in keeping a low death rate and low case count. However, what we do want to show here is that Latinos do make up 26% of the known cases, despite making up only 15 or 16% of the population. There continues to be a large number of quote unknown race ethnicity. The city is working on that, but we suspect that those are in the majority actually Latinos. Next slide. I can give you the demographics for our hospital at Zuckerberg San Francisco General, which is the demographics for hospitalized inpatients. We are the safety net hospital, and so we see the uninsured and federally insured patients of the city. We looked at the first 70 cases. Of those, 64% were men. The median age was 47, and a full 83% were Latino. This is in contrast to the 30% of Latino inpatients that we normally have. 40% lived in high density housing with other adults. 36% lived in multifamily housing. So the prototypical patient that we're seeing here is a middle-aged Latino man with diabetes, with very limited English. These are predominantly Spanish speakers. people have asked us about indigenous languages. We're seeing very few patients who speak only indigenous languages. They are to a person, low-wage workers, and have dense living situations. Next slide. The mitigation strategies that are being tried are, as you know, prevention with education, masks, stay at home, washing hands. This is very difficult because many people are still working, either because they're in essential jobs or for economic necessity. The testing situation in the city is improving. There's going to be a large push this weekend to test one section of the mission, but it is still very much a work in progress. Right now, we're telling people that everyone who is symptomatic, has no insurance, or a doctor can call the number on the screen, and we will connect them through the Department of Public Health with an appointment for testing. That is, of course, free and not subject to public charge. The folks that we are seeing have really live in congregate housing. To give you an example, a patient of mine, which diagnosed this weekend on Sunday, I was not aware of the fact that she and her daughter lived in one room in an apartment where 8 other people live. They shared it with one kitchen and 2 small bathrooms with those folks. Fortunately, she was able to be placed in a hotel. That system is working, but it is still very much a work in progress in terms of not only being offering testing to all of those people, but how can we make that a safe living situation for folks. Finally, we are working closely with the city to do contact tracing. Contact tracing requires naming names of everyone you've been in contact with in the last 2 to 3 days prior to diagnosis. This, of course, requires enormous trust of the system. It requires good testing capacity, and we do now have enough tests for contact tracing. But then again, it also stretches the isolation and quarantine system. There is enough food to support people who need to quarantine, at least in San Francisco. The food distribution system is working well, but nonetheless, I am very optimistic because cases are going down. The number of cases that we're seeing at Zuckerberg in terms of the number of people hospitalized at San Francisco General is going down. And I think that is the best indicator that all of these strategies are working, because it's very difficult and not very meaningful to count cases when we don't have that much case testing capacity. So I hope this quick overview is helpful of the situation in San Francisco, and I will turn to my colleague, Dr. Fernando Mendoza from Santa Clara County and Stanford.
Alicia, thank you. I can have the first slide, the next slide. So we've done many of the things that you have also done in San Francisco. As you probably know, Santa Clara was one of the first counties to have cases, and it looks like we had cases earlier than some of the numbers indicated. But I just want to go over a little bit of what we're seeing now. As of last Wednesday, we had 1962 cases. And what I've done with this graph is show you in the red the cases per 1,000. And you see that we have cities all across the Santa Clara County, and those cities have different amounts of Latinx populations. If you look at it, Gilroy clearly has the most, but San Jose, being the largest, still has about 25%. There's evidence here that clearly social class may be playing a part here. Some of the cities that are have probably higher social class, and therefore, you know, the idea of crowding, the idea of access to care, and those things are probably different from each group. Next slide. So if we look at those cases, the issue becomes what proportion of those cases are really leading on to death. And the population of Santa Clara County is 25% Latinx, as you see on the far left. 38% those that are Asian American. The percent deaths you see there, 31% for Asian Americans, 32% for Latinx. The expected deaths would be different from that, from just the population. So on the far right, you see the reported deaths. And what we see here is more deaths among Latinx and less deaths among Asian Americans. I suspect that that probably is a combination of a variety of factors: social class, access to care. Next slide. So I think one of the things that this epidemic has done is really highlighted the social determinants of health, and health in general, not just being the issue of physical health, but mental health and wellness. And I think as a healthcare system, both in medicine and public health, we really need to think about what are those issues that we should look at. The World Health Organization, the CDC, uses the model on the left here, and it shows that when they conceptualize the determinants of health, a small section of that is genes and biology, a little bit larger for health behaviors, and then access to care. But the large part of it is the environment or the ecology. And some of the factors that we see here as social determinants are those factors that are probably impacting how people get infected with this virus, how they get access to care. I think immigration, and clearly those that may be having immigration issues, undocumented, or the stress of just being in that stage of not knowing what your status is, are probably more at risk just from the standpoint they may be less likely to get care. So one of the things I think we as sort of healthcare providers and community activists, we need to work together to understand, how do we get to these populations? How do we make sure they get the right information? And what can we do to kind of bring down some of these barriers of social determinants so that in an epidemic like we have now, everybody gets access? The key thing to note here is when we talk about public health, it means everybody that lives in our communities. It doesn't segment it by any of these categories. So we have to be able to get to those individuals. And I think discussions like this will help us do that. Thank you.
Thank you, Dr. Mendoza. My name is Heather Ladov. I am a social worker and a supervisor at La Clínica, Casa del Sol. We're an outpatient mental health department. We're really honored to be included here in this great company of activist providers. And next slide. So I want to talk a little bit about how Casa del Sol has transitioned with COVID-19. And I think we're all primary care providers, behavioral health providers, all sorts of community organizations are working to pivot to telemedicine. And I want to talk a bit about how that has worked with our community. And I will say that the community that we see at Casa del Sol, there's a lot of diversity in the Bay Area, but we mostly see people from Mexico and Central America, mostly newly arrived, and monolingual Spanish, with a good handful of indigenous speakers, primarily mom speakers. So we have moved primarily to telemedicine, but we are seeing some patients in clinic for injections and for crisis assessment. There are many people that have thought disorders that use our clinic daily as a place to check in and anchor themselves. And they are coming in still and have to be reminded of shelter in place and that they need to go home and they need to change their pattern of behavior. So that's a daily practice of reminding people. We are in the midst, I think all of us are developing best practices for engaging clients over the phone, and some of us have been able to use video services. There's a lot of emerging creativity here. I think we're really working moment to moment to figure out what works best with this population. And I'll talk about the challenges in the next slide. We're building on our resource list daily. The landscape seems to be changing from moment to moment. What is offered to people in the community, Newsom just came out with the resources for undocumented workers. And so we're really trying to sort of be responsive to that and get the information out to the community as soon as it is made available to us. Next slide. So some of our challenges with moving to telemedicine and this new landscape of not being able to see as many people in person is how we work with our clients over the phone. For families and younger children, how do we do play therapy over the phone? What does that look like? We do a lot of engaging with parents around how do they take care of their child, how do they address symptoms, but what do those modalities look like in this new world? Clients with psychosis or negative symptoms of schizophrenia, where their social ability is compromised, or they're not really able to talk in that traditional way, we have really been challenged in trying to meet their needs in this distance way. We are building a new container for therapy and behavioral health. As Dr. Fernández mentioned, a lot of people live in very cramped conditions in very, very small spaces. And so trying to find privacy in a place where they can carve out to talk about more deeper level issues in their past, trauma, history, this is really virtually impossible when people are crowded into space and they can't find that container that we once had. I think the big thing that I want to mention today is that our new requests for services has dropped significantly. We used to see up to 8 people a day requesting new services. Now it's dropped to 1 or 2 a week. And we're working on building that back with letting the community know that we are still working, that we are seeing people over the phone and providing services, opening up new cases. And we want to provide behavioral health services right now. Wondering why that is that people aren't reaching out. I think that, people maybe don't know that these services are continuing to be provided. People are maybe focusing on basic needs, that it's harder now to find food and engage in the things that once maybe seemed easier. So maybe thinking that behavioral health or accessing support around that isn't the first thing that people need to do. I also want to mention the struggle that we've had around access to information technology in the community that we work with. We've tried to do video with some of our patients, and trying to get people to download an app or to access that in a more advanced way has been challenging. I'll also speak to our children and families in that we've moved to distance learning with all of the school districts, and it's a big concern of mine that our families are not, with a language barrier and technology barrier, are not able to engage in distance learning as easily, and we'll see more inequities around academics as time moves on. Last slide. I just want to put out the information about Casa del Sol and really stress that we want new patients and clients to our clinic. That's on the slide. You can see the way to contact us to schedule an appointment. This is in the East Bay in Alameda County, but I know we'll be providing resources about behavioral health throughout the system. Thanks.
Please go ahead.
Thank you, Heather. I'm Dr. Gena Castro Rodriguez. I'm the Chief of Victim Services for the San Francisco District Attorney's Office. Thank you so much for being here today. I'm happy to talk about the work that we're doing in San Francisco. Slide. One of the things that we are paying close attention to right now is domestic violence. The first week of the shelter in place, we saw a drastic increase in the number of clients that we were working with, 60% increase. And then even more concerning is that the next week the cases dropped down, and we're now at a 10% decrease for the following weeks compared to the same time period last year. Victims that we are engaging with is that they need the basic necessities. They need shelter, food, and money. They are out of work. They're missing the opportunity to make money, and they just don't have the basic things that they need. We hear that they have an increase in isolation, increase in stress, increase in worry about their health and their family, and increasing about what's going to happen with work and recovery from this. We also have heard from our staff members that some Latinx people who are from that speak indigenous languages don't have a lot of information about what's going on with COVID-19, and they're asking us what's going on. They're not sure why things are closed. They're not sure why they can't access resources. So some of the work we've been doing is trying to inform the community too. What we're doing around this issue is, one, raising awareness, particularly around domestic violence, letting people know that home is not safe for everyone right now, and that we need to be checking on people. We need to be engaging with people. We need to be making sure that people are safe and not being hurt. We've also created some unique new partnerships with for-profit businesses like Veritas Investments and Lyft, so that we could provide more resources to domestic violence survivors. With Veritas, we've secured 20 apartments in San Francisco with a 3-month lease term that we can put survivors in if they need to relocate and get out of their home and get into a safe place. And then we've partnered with Lyft to provide rides to relocate them, or to take them to services like health services or mental health services if they need that. We've also partnered with several agencies in the community to provide wraparound services for our clients. We have a light touch because we serve thousands of people every year, 9,500 last year. So the agencies listed, the Asian Women's Shelter, La Casa, Women's Inc., KUAV, Glide, and SF War have stepped up to work with our clients in a more in-depth capacity so that they can get wraparound services. Slide. Another area we're really paying attention to right now is child abuse. So we have a 72% decrease in reported and engagement with clients around child abuse right now. That's really significant because last year at the same time period, we were working with about 19 victims every week. At this same period this year, we're working with about 5. We don't believe that that means that child abuse and sexual abuse are not happening. We believe that it's not being reported, which means that children are at home and are enduring trauma rather than being kept safe and receiving services. That population is also overrepresented of Latinx people for us. Last year, they were about 38% of the clients that we were seeing around child abuse and sexual abuse. And right now we're at about 20%. With schools closed, children don't have access to safe space during the day. They don't have multiple healthy people having eyes on them. They're not interacting with mandated reporters who could be looking for signs and symptoms of abuse. And so they're home and no one is able to see that outside of their family. One thing that we're really trying to do is get parents more resources. We know that they're under stress. We know that this is a hard time for them. And so we're trying to reach out and give more support to parents, financial support, emotional support, mental health support, and resources so that they can take care of their children. Slide. This is National Victims of Crime Week, a big week for us, but for the first time, we've had to do everything virtually. So we focus on some of the crime types that are really important right now during COVID-19. We have some information and resources around domestic violence that I spoke about. We're doing a campaign to make elders aware of COVID-19 scams and fraud that are out there right now. There are videos available on this link in our website in 5 different languages that you can share with your clients. We are focusing on child abuse and providing resources and information to parents so that we can help to relieve some stress and anxiety and help them parent. We are doing some work around hate crimes, which has been on the increase for the last month and a half, particularly in the Asian community. We have a video there about hate crimes, what they are, and how to access resources in 3 different languages. And then today we're partnering with Mothers Against Drunk Drivers about the importance of safety and not driving while drunk and how that impacts families. Thank you.
Thank you, Dr. Castro Rodriguez. Good morning, everyone. My name is Chris Iglesias. I'm the CEO of the Unity Council, located in East Oakland in the Fruitvale neighborhood. And I'm glad to be with you this morning to talk about what we're seeing and what our clients are seeing. I want to thank my staff, Itzel, for these wonderful slides that she's put together. That just gives a little information about who we are and some of the families and those that we serve. More information at our website at unitycouncil.org. You go to the next slide. I think what I really want to talk about today is that there was already a crisis happening in our communities, prior to COVID, right? There was a economic crisis, there was a housing crisis, there was displacement, economic inequality. So there was already enormous pressure on the folks that we serve already, and then COVID hit, and it's really changed a lot what we do as an organization, as a social equity development corporation. I think a lot of our partners, whether it's like Clínica or Kaiser or Centro, is I think a lot of them see the Unity Council as kind of like an economic security blanket for the community. And I think right now we need to spread that blanket much on a much bigger basis right now, because what we're seeing, and it's interesting because I think on the Chronicle on Wednesday, there was an article talking about how the Bay Area has done such a great job about flattening the curve, right? Flattening the curve. They actually called it the Bay Area is crushing the curve or something like that, which is great, right? And it goes out to the health professionals that are on this webinar this morning. But I think that's great, but the needs in the community have gone like this. I mean, literally just straight up, right? And they're basic. Food insecurity is through the roof, and money, because a lot of the folks that we work with are undocumented, so they're not benefiting from the federal stimulus fund. So, okay, so how do we get them food? We like on a daily basis, we were already serving primarily through our early childhood education, maybe 700 families a day, providing meals to the children and stuff like that, and then also daily lunches at our San Antonio Fruitvale Senior Center. So let's say 750. Now we're serving probably almost 1,400 families a week groceries, right? We have 4 senior housing developments. We've had a COVID case in one of them. We basically had to shut them all down. So now we have to bring them food. So we have a big partnership with Alameda County Food Bank and other organizations. The one food necessity is urgent, and so now it's basically doubled with us. So let's say it's at 1,400 families a week. That number is going up. We're also working, or hopefully growing a partnership with World Central Kitchen, which they're actually just hiring restaurants to make 200 to 300, 400 meals a day that we're distributing. I think so. That's a huge one. The other one is money, right? Folks need money. So ourselves, I know Centro, I know Theresa is going to talk about it. How do we get resources into the community immediately? And I think we're seeing the philanthropic community step up big time, whether it's Hellman, Crankstart, San Francisco Foundation, moving lots of capital into the community, where we're basically trying to grant it out, and with these mini grants, $500, $600, just to get folks some basic necessities to get them through, especially if the shelter in place continues to go on. I think the other thing that we talked about, and we've talked about this even before with the governor and his team, is that you always hear California is the 5th largest economy in the world, the 5th largest economy in the world. It is, right? Who carries the economy? Latinos carry it, right? You can look at all these different industries, whether it's agriculture, construction, or whatever. It's carried by Latinos. So the economic recovery that's going to happen is going to be on our backs as well. So we have to assure the health, the well-being of our community, and I think that's why these webinars are so important, to really figure out how we all can work together to really have a strong recovery, but at the same time keep our folks safe. Can I go to the next slide real quick? So this just kind of gives you an idea of all the different things that we do, but really with the economic security in mind to help support our community. So thank you very much.
Thank you, Chris. I appreciate your presentation. Thank you to my colleagues on the panel for this opportunity. My name is Theresa Gonzales. I'm the Executive Director of Centro Legal de la Raza. We were founded in 1969, just celebrated our 50-year anniversary. We are a legal service organization protecting and advancing the rights of low-income immigrant and Latinx communities through bilingual legal representation, education, and advocacy. In addition to the legal services and know your rights education and policy work, we also focus on youth development. And we serve thousands of individuals each year throughout Northern and Central California, but we are also rooted in Fruitvale and have been serving the Oakland community for our entire life trajectory as an organization. Today, and you could go to the next slide. Today, I'm going to share sort of 3 major focal areas. Number 1, talking about the landscape of legal services through COVID and how Bay Area organizations are responding and continuing to serve the great need that we see. And then I'll be talking about advocacy efforts as well as resources that have been made available in terms of rapid response. And then my final piece will be sharing a little bit more about our long-term legal strategies and some things that we're having conversations about, or things that have already been initiated. So in terms of the landscape of remote legal services, as you all know, many of the courts have been closed, not entirely. And just to provide some perspective, we at Centro Legal provide legal services in the areas of worker rights, tenants' rights, excuse me, and immigrant rights. So I'll be focusing on the span of housing, employment, and immigration. Us and all of our fellow legal aid organizations in the Bay Area have been working really closely to share best practices on ensuring our operations are steady and maintained, and that we have the necessary infrastructure in place to be able to continue to meet the need. I have some general sort of updates on the court closures. I know a lot of our clients and community members are unaware of these changes because they are happening day by day, new developments with the state and also local orders. But as of today, you know, around housing and employment, the Alameda County Superior Court is going to be opening up in a limited capacity on May the 4th. So that's right around the corner. So we're thinking about how we move back from remote to providing services in person and ensuring that we're maintaining public health guidelines and ensuring that our community is safe. Also, in terms of the new cases, we're looking at that, not really us having to deal with that until after the orders are lifted. We're having some, you know, we're still providing or showing up for cases virtually, and we're ensuring that our attorneys are being trained up in terms of providing these services in a new way. And then jury trials will not be done until July at the earliest. In terms of affirmative litigation, we do have an impact in affirmative litigation arm to our work. These are class action lawsuits, many of them that we co-counsel with other local private firms as well as national firms such as ACLU and others. And the federal courts have not closed, so hearings will continue, but we do see definitely the impacts of you know, the different actors that we are in court with having, you know, thinking about bankruptcy and other things, which will impact, you know, the outcome for many settlements in cases that we are representing clients for. In terms of immigration detention, our detention master calendar hearings in SIJS have been virtual and they have continued, but the SF Court is planning to reopen on May 15th. And again, this is just sort of an update on what is going on within the legal sector. And of course, if you have any other questions, you can reach out to us, and there is a resource page available. You can go to the next slide. So what have we done in response to COVID? We have ramped up our advocacy efforts in addition to try to adjust to a whole new world through this pandemic. We have really stepped up in terms of our collective impact work and coalition building. We have been working collaboratively and co-led on several of the eviction moratoria that you all have seen happening in different jurisdictions. For example, the City of Alameda, City of Oakland, City of Hayward, and Alameda County. This is a point of, I think, a point that I want to raise that is important for clients to know or community members to know is that, you know, the moratoria looks different in each one of these jurisdictions. So it's really complicated, just like the state orders are. And so it's important that, you know, that community is able to access legal counsel or get some consultation so they can understand, you know, how, you know, these moratorium are actually will affect them specifically in their areas, in their districts. And so, you know, there's no blanket eviction moratorium right now. They're all different. And so please reach out or have folks reach out to us if they have questions. In addition to that work, we've also are ramping up our emergency financial assistance for tenants and homeowners. This is a program that we provided pre-COVID, and we're also speaking with our local jurisdiction partners, public-private partnerships to increase those funds so we can provide more financial assistance for those who are facing eviction. And currently, those funds are available in the City of Alameda, City of Oakland, Alameda County, and Centro Legal actually manages the EFA for those three jurisdictions, but the City of Berkeley is actually managed by the East Bay Community Law Center if they folks in Berkeley want to access that. Centro Legal also immediately pivoted and knew immediately through our workers' rights team that we're going to have a gap in terms of access to services and benefits for our undocumented community members. And so we launched the Oakland Undocumented Fund within, I would say, the first week of COVID. It was actually the second week of COVID, but working with many non-legal and legal partners to make this a reality. So we have launched the Local Worker Relief Fund, and we are also at the table of a statewide coalition that is actually being facilitated by grant makers concerned for immigrant rights, which they have fundraised several $1 million and are looking to distribute that throughout the county. And then we have the statewide initiative that was brought up or mentioned a little bit earlier around Governor Newsom and his $125 million fund. And so we are part of those conversations. The governor's fund is going to be channeled. Well, the most recent development is that it's going to be channeled through California Department of Social Services, and so that there's more information to come. I know that they're having a meeting today with the grantees and recipients to talk a little bit more about how that money is going to flow through CDSS and get to the community. But we're part of the statewide coalition and also the local worker relief fund. A little bit about that. Within the first week of us launching our applications, we received 800 applications. By the third week, we had 3,000 applicants. We are providing $500 stipend to community members who qualify. So we have, a screening process that's not as much as possible, not cumbersome for the folks who are applying, who are in desperate need right now. But we have closed the portal currently as we continue to fundraise, because we've maxed the cap on how many people we can serve in Oakland specifically. However, there is more funds coming. And then, day by day, we've actually are receiving more and more individual donations. But we want to be able to serve, the folks that we have in the pipeline right now. And we'll continue to expand that as we have conversations with the statewide coalition and funneling some of those monies, not just to Oakland, but to the broader county and Bay Area. We've also released with some of our partners a comprehensive workers guide to explain legal protections of workers. A lot of these protections have been expanded over this time period, and so on our website you'll see that you'll see the actual workers guide, very comprehensive, very helpful. So please direct people to our website. And it will explain the local, state, and federal protections that existed pre-COVID, and then also that have been expanded during COVID. Finally, we are working, with our immigrant legal service organizations as well as our community-based organizations to focus on release efforts for the medically vulnerable and those who are immune compromised. And also, Centro Legal has has a distinct, actually, reentry planning initiative. And so we are focused on ICE detention facilities and then also the current release of detainees from Santa Rita, and ensuring that we are able to hold not just release our folks, but making sure that we're connecting with their families and we're getting them the appropriate services and testing that they need in order to successfully reintegrate, and that they're not also being caught up, and transferred through ICE holds and other things because they are definitely at risk. So we're thinking about the long-term implications of release and not just setting people free, but making sure that they have the necessary resources, they have housing and all of those things when they are released. There was also a recent decision, very positive, just happened a couple of days ago, requiring ICE to review for release of every person nationwide with COVID risk factors. And so that was a huge victory for us, and we continue to advocate as much as necessary, not just within the state of California, but also nationally. You can go to the next slide. So some long-term strategies, there's a lot going on. So definitely couldn't cover everything in this presentation, but we are thinking about the economic recovery long-term. And one example is looking at rent forgiveness. So we have the eviction moratoria, but that's only, it's only putting, that money on hold or on pause, right? That is owed, that debt that's owed. And so we're looking at long-term rent forgiveness for low-income tenants and homeowners. In addition to that, with our workers' rights team, we're looking at a safety net for all, which is expanding benefit programs to make them available to folks who traditionally don't qualify due to their status. And then there's a link there to that will be shared later with our 100+ sort of collaborative organizations calling on the governor to do this, and more of the detail on what it is that we're asking for. In terms of immigration, a lot of these efforts were occurring pre-COVID and has been exacerbated, of course, through the crisis. So we have been working to build a legal services response that prioritizes release of those at risk, but also long-term strategies for decarceration. One example would be through our AB 32 that recently got passed with private detention facilities and their ability to sign new contracts with ICE. And also including one thing that we feel is super critical is our collaboration with our non-legal service providers. They are the folks that have ears to the ground. They have close proximity to our families, the families that we're serving. And so we have worked with them specifically, like an example would be in Central California or in the Central Valley. we heavily rely on our non-legal partners to be able to meet the families and make sure that folks, for example, that are being released from Mesa Verde detention facility have a warm welcome when they come home. And so we're looking at ways to increase coordination and resources for our non-legal partners. And that way we can identify the most vulnerable and make sure that they get home safely. We've also been working to expand pro se assistance. This is about empowering community and giving them the education they need in order to be able to appear in court for themselves and to become legal advocates in a more informal way. Finally, as many of you may be aware of, the Supreme Court decision related to DACA has been, looming over us for quite some time now. We're looking at a decision and potentially an adverse action that may happen as soon as this early next week. So we're definitely coordinating with our partners around how we're going to respond to that to protect all documented community members that we have connection or close proximity to, especially those who have prior removal orders. And so that pretty much sums up, I think, the broader areas that we've been focused on through COVID and what we're thinking long term. And definitely welcome questions and you reaching out to us. And the next slide, I believe, is our resource page.
Next slide, please. Terrific. Thank you all very much. And we still have about 15 minutes for questions. So we look forward to having your questions come in. While we're gathering those, and Julia, you should signal me. I had a question for you, Chris.
Mm-hmm.
Tell me your sense of optimism versus non-optimism about what the next few weeks and months will hold for our communities in terms of both in terms of the amount of resources that are needed and the slow, the very welcome opening of funds that are coming through. How are you feeling? And
I do feel optimistic. I think it's wonderful to see the numbers low, the numbers of infections, new folks getting, or hopefully those numbers don't climb. But I think I feel very proud because I think we have a very resilient community. We've seen some amazing acts of humanity over during this time. People just stepping up in all different ways. I think I have so many staff members that are they're just chomping at the bit. They want to get back. They want to get engaged. And I think now we just want to make sure we understand what that looks like and how we do that in a safe way. We really take care of our peeps. So I think that's really what we're trying to understand. How do we best do that? I know, how do we work with La Clínica? I know they were, is there some ways we could do increased testing or screening or something like that with them right there in the community quickly? So I think as those kinds of things happen, it does create a level of optimism, because I think we can come through this recovery strong, but we just really have to make sure folks are safe. Thank you.
Julia, are you ready with questions?
Yes, we have a handful of questions in regarding resources. So I'm just going to go ahead and I sent a link to the entire chat. You should be able to see it in the chat box. It has a link to our resource page and also a link to recorded past webinars, and this webinar will also be posted there as well. We have a question coming in. How are different organizations engaging religious communities? There's been concern over communities still trying to gather in person. Has there been any engagement with the community on this?
We have a volunteer. I think it's excellent. It's an excellent question, and the fact that none of us is rushing to volunteer to answer it. Now, please raise your hand or signal. Shows you that this may be not one of our strengths, at least of the group represented here. I do know that the coalition, the Latinx Task Force of community groups in San Francisco does include some of the church groups and does have a better contact with church folks, but it is something that we are going to have to address. It is obviously very important. Theresa.
Oh, just wanted to share that we are in partnership with several interfaith organizations that are community-based on the ground. They're mostly our non-legal partners. For example, we are the Centro Legales, the fiscal administrator for several collaboratives through our workers' rights team, anti-displacement efforts, and also our immigration rapid response. So we have 10 partner organizations in our Alameda County Immigrant Legal and Education Partnership, and we have Faith in Action East Bay, we have Interfaith Movement for Human Integrity, and those are folks that are working with us on immigration issues, but also at the intersection of several other issues related to criminal justice reform and housing and other equity issues. And so they're at the table with us. We actually have a hotline. We've had a hotline since the beginning of 2017. And we're also currently supporting Stand Together Contra Costa and Contra Costa County, which also incorporate a lot of faith-based organizers and community members. And so we sponsor the hotline together and, are monitoring ICE activity and ICE enforcement. And then we're also providing resources to several organizations that are many outside of even the 10 organizations. So that's one way that we continue to partner and identify them as a critical partner in being able to do this work with the Latino community.
Julia, could you read out 3 more questions? And I'm going to ask all of us to keep our answers really brief so that we have a lot of community voices. Please go ahead and read out 3 questions.
Sure. The first one is, there have been a lot of resources presented here. How are these resources being presented to the community, and are they available in multiple languages?
Good.
Another question has to do with, are there any noticeable trends in hospitalizations due to opioid overdoses or particular issues surrounding delivery of harm reduction services?
Good.
And also, can you speak a little bit to the COVID testing that is supposed to take place in the Mission community this weekend?
Yes. Good. So I'm going to go to Heather for the question on opiates. I think you want to answer that. Is that right? No. Heather, please go ahead, and then we can. And then Julia, if you don't mind preparing another 3, that would be great. Go ahead, Heather.
I'll answer the first questions around getting resources out to the community, because I think this is a big one. We have a peer counselor that we have kept very busy during this time. He's the one that's kind of researching all the new resources that are coming out. And just starting with our client base, we have been working on calling through all of them and assessing their technology capacity and their needs. And so just with that base, I would hope, we continue to work together with Centro Legal and the Unity Council, but to really just sort of get that word out, because I'm concerned about the access to resources and what is or isn't available through the media, the Spanish language media, and how that's being disseminated.
Great. Fernando.
Just real quickly, if you look at Santa Clara County, they have a website that has current data, but also has access to different aspects of life, basically, of immigration, childcare, et cetera. So I think one of the big challenges is to connect our communities with our public health groups, right? Because they're not always very much connected. So while we spend a lot of time connecting with our advocacy groups, I think it's critical to try in this, in this pandemic, to connect our health structures better with our communities. I think that has long-term implications, and I think right now would be a perfect time to do that.
Terrific. And I know that we've been doing FaceTime Live and other things just directly to community members. For resources in other languages, I think all of us have resources, obviously in English and Spanish. The District Attorney's Office offered additional languages. And if there's something specific you want, please feel free to text any of us. Let me answer the question about harm reduction. And for this, I thank Dr. Marlene Martin, who is one of the hospitalists at San Francisco General, a specialist in addiction medicine, who is texting me as we speak. And we are seeing a rise in overdoses. I don't know how high that is, but we are really working organized at to do harm reduction in different ways. All the isolation and quarantine sites have staff and providers who are trained in harm reduction and are really trying to help people with harm reduction modalities and treatment. However, this rise in overdoses was happening before COVID, so we're not sure if what we're seeing now, and I don't have a way of quantifying that right now, is COVID related. But obviously, this increased social isolation for people who use drugs and overdose is something that is very worrisome, and it's something that we're paying a lot of attention to. I do want to add that the isolation and quarantine teams have been terrific about trying to work with us and with our specialists and in harm reduction, both in the shelter population and in the non-shelter population. To answer very rapidly, as we take an additional 3 questions, what's happening in the mission this weekend is a research study in collaboration from UCSF researchers in collaboration with the Department of Public Health. They are attempting to test all 5,000 people in one high density tract in the mission in order to see the amount of COVID prevalence and also to do antibody testing to see if we can get a sense of how many people have had past infections. That testing, of course, will be free and so on. And we will also have ways to connect people who do not live in that census tract with this free testing from the Department of Public Health that would be available for anyone, regardless of whether they live in that census tract, in the Mission, in the Bayview, or other places in San Francisco. And just a reminder that people with symptoms can always come in to San Francisco General, where we have set up urgent care testing for people with symptoms, regardless of your insurance status, and obviously regardless of immigration status. Julia, could we hear another 3 questions?
Sure. Can you speak to the resources for folks who need to isolate themselves but can't in their home because of overcrowding? For those impacted by courts closing and who do not have legal representation, do they need to reschedule, or will someone from the court reach out to them? And lastly, are there any volunteer opportunities to help disseminate these resources?
Great questions. Theresa, I'm going to go to you for the court question, if you can give us a pithy answer on that.
Okay, thank you. I will actually have, so there's different courts, and I think that the way that they are responding is different. So my suggestion is for you to contact our organization. We have, the number is on, I believe it will be on the resource page, but you can call us directly and set up a legal consult to talk about your case, where you're at, because it really will vary just depending on where you're at with your particular hearing, whether it's civil or criminal. So yeah, so I wouldn't want to give any legal advice over webinar. Please contact our staff, and then they will direct you in the right way. And we do, we're focused on housing, employment, and immigration. So, but we can refer you out if it's not specific to those key areas of law.
Can people contact you if they're not Alameda County residents?
Yes, well, we have a regional network, so we will do our best to refer them to the appropriate person. Absolutely.
Fantastic.
And we've actually increased our hotline and our helpline around particular areas, so we do have additional staff to be able to vet and do, you know, be able to field questions.
Gena, is there anything you want to add on the legal side?
Yeah, on criminal cases, we have advocates that are contacting every single person who had or has a case coming up and giving them the most up-to-date information on what's going on with those cases. And you could always call us at 628-652-4100, leave your name and number, and we'll get back to you and give you an update on your case.
Fantastic. Chris, do you have a good answer on how can people help? How can they volunteer to disseminate these resources?
Yeah, I think you could get in touch with our staff. I think if you go to our website, the first thing that pops up is like some information on COVID and how you can participate. So definitely could use volunteers as far for the food distribution, drivers and packers and all that kind of stuff. Again, it's in a safe, we do it in a very safe social distancing manner. So yeah, but through the website would be the best way. And I think right now we've also joined Keep Oakland Housed. So the work that we're going to be doing around housing security, and is something that we also may need more volunteers in that area too. Thank you.
Fantastic. And we will also be posting resources on our website that people can use. And then finally, there are coalitions of CBOs in the mission who might also need volunteers, but especially the food delivery systems and the food banks and the San Francisco Marin Food Bank need volunteers. We are out of time. Let me just say that there are attempts on isolation that the city is helping with. The city the City Department of Public Health has stepped up in a magnificent way. They are doing everything they can to help people isolate. This is very much a work in progress and needs a lot more support, and it needs a lot more economic and other support from the greater Bay Area and from the communities that may be less economically impacted by all of this. So please don't forget our role as civil leaders to make the larger community aware of the needs and looking for help and philanthropy for all of us. It is 11 o'clock. We do want to end on time because we really appreciate the 200 or more of you who joined us today. We want to say that we hope to come back in different configurations. All of the organizations represented here would be highly appreciative of any support you could give us in terms of philanthropic or advocacy or anything. And we are here to support you, which is more to the point, and both with information, resources, and reach out to us. Let us know how we can help, and we will do our best to connect amongst ourselves and with other community-based organizations. With that, let me just thank again Chris Iglesias, Fernando Mendoza, Heather Ladov, Theresa Gonzales, and Gena Castro Rodriguez. We very much are delighted to have had this opportunity to work with you and look forward to doing that again. Thank you all.
Thank you.
Thank you.